everybody. Welcome back to Dad Space. It's a podcast for dads by dads. I love when I get to meet people in the dad space, hence the name of the show, who come with great resources and things that can help us as dads. I'm just going to go back in time for a second. I remember being in the hospital for my second born and feeling completely overwhelmed. I'm dealing with my firstborn, trying to find somebody to watch him while I'm waiting for my daughter to be born. There's nurses running around, doctors pushing me out of the way. I just feel like I'm in the way all the time. And I wish there was somebody who could just pull me aside and go, it's going to be okay. We're going to be all right here. And Chris is here today. So excited to have him on the show. He's got a new book coming out at the time of recording. It's coming out really soon. And as I contemplate the topic of Chris's book, I think this book would have been perfect for me in that moment. If I had read this and had this knowledge ahead of time, I think this is some of the things I was dealing with. We're going to get into it more. So Chris, welcome to the show. It's good to have Chris on the podcast. Your book is coming out. Congratulations. Welcome to Dad Space. Nice to have you here.
It's great to be here, Dave. Thank you very much.
Excellent. Excellent. Let's start with this. Everybody wants to know, where are you, Chris, in this big world of ours?
I am in our house in Marin County, California, which is just north of the Golden Gate Bridge. And we moved here from the city about 2 years ago because this is what all the dads tell you to do, is to move to the suburbs and get a yard and get good schools. And it's been great. We love it up here.
Good. You're in the burbs. Good job.
That's right. That's right.
I like it. You have an interesting career. You help a lot of people, and a lot of people would know you as Dr. Chris. Tell everybody a little bit about what you do as well. This is really interesting.
Sure. Thanks, Dave. So I'm an anesthesiologist, and I went to college, graduate school, and medical school, and graduated as a doctor in 2005. And after medical school, you do what's called residency, where you specialize in something like surgery, pediatrics, anesthesiology, dermatology, psychiatry. And so that was 4 years for me. And then I did an additional year in order to become board certified in critical care medicine, which is the care of patients in the intensive care unit. And so for 12 years, the first 12 years of my career, I did both clinical anesthesia in the operating room as well as intensive care medicine. And I was a professor at the University of California, San Francisco, here in town. And then I recently, in 2022, transitioned out of that university professor role, and now I take care of patients out here in Marin County.
Excellent. Okay. As a doctor, you get to deal with people at some of the happiest times and some of the worst times, right? What is it about your career that you love? Could you work some crazy hours? You work a lot. What are some of the things that just when you arrive at the hospital, you show up, you're ready to go? What brings you back all the time?
That's a great question. I think you hit the nail on the head when it came down to helping and relating to people when they are in one of the most vulnerable moments of their lives. So certainly from the perspective of somebody having an emergency surgery for something that is acute and serious and dangerous, that's something that I have a lot of familiarity with from my role at the university, where mostly you're dealing with the sickest of the sick. And certainly during the COVID pandemic early on, while I was taking care of patients in the intensive care unit, there was a lot of that. People were frightened, people were alone because of the isolation, and people were near death regularly. And so I think being able to have the ability and the comfort with relating to people in those moments, in those scary, horrific moments, is something that really drove me. I think I really enjoyed working in high-functioning teams. So at the university, we had trainees, we had residents and students and fellows, and it was really fun getting to perform with that whole team. Now out in the community, I find, an anesthesiologist doesn't often know their patients before the day of surgery. And so you have this need to be able to relate to them very quickly and earn trust very quickly. And what I find up here, and I think it probably has to do with the transition that I've made in my own life as a result of what happened to me after my girls were born, that I find a great deal of joy relating to my patients and having a conversation with them and really meeting them where they are. And I feel a great sense of openness with that relationship with those patients, and that's new for me over the last few years. And I find that is a profound source of joy in my job that I have now.
I was going through your Instagram today, watching your clips.
Such as it is.
I gotta say, I love how you approach just talking to the camera and talking to that dad. Like it just, you talked about creating a relationship quickly with your patients. I feel like you're doing that through a camera lens with the person on the other end.
Thank you.
On Instagram. So just so you know, I feel that already. So when you said that's how you like to deal with your patients, it's how you're dealing with your community. And I felt it right away. So
thank you.
them. And I want everyone to go and follow you and be a part of this.
Thank you.
You really, it's very candid. You're just talking to us. I love it.
I'm glad that comes across. When you're watching yourself, you don't always know. I mean, because you know your own tics and you know what the words mean, and it's rewarding to hear from you that really comes across.
Yeah, the idea of the
and I think too and I'm sorry to interrupt you. I think you mentioned something that was really important, the candor, and I would call it vulnerability, and that didn't come naturally to me, but in the process of writing the book, I really had to be very open and very vulnerable and honest about what I was experiencing. And that's in part because I think the topic demanded it. I didn't want to write an academic treatise on men getting depressed and anxious after their kids were born. But also, I think book writing as a catharsis demanded that I get all of this stuff out of me. And in order to do that, you really have to be truthful with yourself and truthful with the page, because anything less than that is not going to achieve that goal of catharsis.
Now, as a doctor, as a professional, I want my doctor to be confident, to have the facts, to have an answer for whatever's happening in the moment. I want to have confidence in what my doctor says to me. And when you're a confident person like that in the room, it's very hard to let that side down and it be you as a dad and talk about your own story, right? Where you're here to serve and help others all the time. Is that something you had to kind of work through, is presenting yourself in this new light as someone just sharing your story and kind of all of the warts and everything a part of it as well?
That's a very insightful question. And I learned something in graduate school. So in addition to being a physician, I was first a graduate student in a doctoral program in counseling psychology, thinking I would be a therapist and a professor. I know, who knew? And one of the things that I learned there, and it was at first just sort of a trite line, but it applies to a lot of things in life. The things that we often think of as our strengths are actually weaknesses. And the things that we often think of our weaknesses can actually be strengths. And I think as a man, there is a tendency to feel as though emotional vulnerability and emotional connection can be a sign of weakness, that if you're crying with a patient because something deep is happening, or if you are sensitive or emotive, you are not giving off that confident, strong vibe. But here's where that phrase really comes into play. You think it's a weakness, but I have found that it's actually a strength. And I have found that patients will relate to me, they will trust me, they will open up to me when I open up to them, particularly in the labor and delivery setting. So anesthesiologists, in addition to taking care of patients in an operating room, take care of patients in the labor and delivery context. So I'm meeting patients who are in labor who need an epidural for pain relief, right, or meeting patients before an operating room delivery, like a cesarean section. And so these are very scary periods of time for people. And I have found that the more human I am with these patients, the more relaxed and calm and trusting they become, and the more confident they become in my competence. And so it's just the opposite. I think the more I lean into that, the more competent and capable I appear.
Okay, we're going to have an intervention today because here's what happened to me and why I started Dad Space.
Okay.
When I had to go back to my second born in the hospital, and all the beeping's going on in the room. My wife's getting prepped to have the baby. Everyone's buzzing around. Again, people are pushing me out of the way because I'm in the way. I'm always in the way. And the doctor pulled me aside and said, okay, my wife, Jennifer is our main focus right now. We're all focused on her. I need you to step back and just stay back out of the way. I know you want to be a part of this, but please just back away. Give us a chance to get set up. He was trying to lighten it up a little bit. He said, if you pass out, there's nobody going to catch you because we're all here with her. So you're on your own there. And then he said this in kind of an offhanded way and went back to work. He said, there's nobody here for you. And he turned his attention back to my wife. And I was just kind of like back in the back corner of the room, and just stayed in my spot. But the next day, after family had come and gone, baby was born, family had come and gone, got our congratulations, the cards, the flowers, all the little teddy bears. Everybody went back home, and I'm holding my daughter. And my wife is resting. It's just me and her. And all I could think of was a professional, a doctor who knows the answers to everything in my mind, right? I'm just thrilled that everything went well. That those words, there's nobody here for you. I started getting overwhelmed. Like, who am I, me, Dave, to have this human in my hands? I don't feel like I have the tools to do this right. I'm going to mess this up. Something's going to happen here. And I think I started really doubting myself in the moment because in my mind, I just couldn't shake the words that there's nobody here for you. Like, you got to figure this out.
Do you think it was that you didn't have confidence in your ability to deal with medical issues with the baby, or was it the larger kind of, how do I raise this person to be a competent, capable, happy, fulfilled human?
Do I have enough in the tank to even do this? Like, my confidence was shaken, not just by the words of the doctor, which was not his intent at all.
No,
just that
I'm sure.
I couldn't shake that from my head. That I am on my own here. Like, my family's going to go back to their community and move back home. And my wife and I are in a different city, far from family, just the four of us with her. And I'm just like, I don't know if I can do this. And I think I started to doubt myself and get overwhelmed. And I didn't know who to talk to, right? In that moment. So as I think of this podcast, I wanted to bring on amazing people like you to help a dad who feels like they're in that moment going, I don't know what I'm doing. And I don't think I know I'm going to do this well or not. I have no measurement to see if I'm doing well. And when we go home with the baby, they wave at us from the nurse's station and we walk out. Nobody follows us out to make sure we do it right. Nobody checks on us a day later at the house. Goodbye, right? And I think from your perspective and the fact that you wrote this book, I think as I read through this and read through what you've written about the book and how you're talking about and presenting it, there's elements of what you've written I think I needed in that moment. I really think I needed it.
I wish it had been there for you when you were going through this. I wish it had been there for me when I was going through it. I think for me, just the recognition that feeling the way that I was feeling can be, I don't want to call it normal, but I spent so many months feeling, in a sense, ashamed of how I was feeling. I was overwhelmed. I was irritable. I was angry. I felt as though in order to tame the chaos of newborn and infant twins, we had to have systems and regimentation and rules. And I just couldn't get my wife, Lindsay, and the other people that were helping us on board with the intense degree of regimentation that my need for control was exerting on everybody. And I think if I had known earlier that I wasn't well, that men can get postpartum depression, and that parent, I had this idea that being a parent was just awful, and that's just how it was. And I wasn't very good at it, and that's just how it was. And I think if I had known that there's this entity out there that sometimes men get depressed and anxious, and it's the hormones, it's their own upbringing, it's the other stresses, it's witnessing the birth trauma that we went through. All of those things put a man at risk for feeling that way. And if I had known, it's sort of like as a doctor, well, if there's a disease, at least then that means there's a treatment. If parenting just sucks and your life is just chaotic, there's no treatment for that. And so in a very almost medicalized way, knowing the name for what I had gave me hope that at least I have something, at least there's an explanation. And if I had something, maybe I could get better.
I also kind of felt guilty for feeling this
Yes.
way.
Yes, because you're not if there's ever a time
Right.
when the non-birth parent, when the father is supposed to not have needs, it's
Right.
it's right after your spouse gives birth. And mine had a surgical delivery, and she lost a ton of blood, and she had to have a hysterectomy to save her life, and she almost died, and on and on and on. And so I really wasn't supposed to have needs. And yet, what if you do?
Right.
If you're suffering, everybody's suffering. And that goes for the mom, and it goes for the dad. And so there just has to be room to acknowledge that even though you're not trying to take attention away from the birth parent, from the mom, if you have needs, you got to try to meet them, or the wheels are going to come off.
Do you think your medical background was an advantage or a disadvantage in that moment?
I think that it ebbed and flowed at different stages in the process. So, for example, in the operating room, watching everything that was going on, there was this really big challenge for me, because normally that's where I am the person doing the saving.
Yeah.
And to have to watch created kind of a surreal mindset for me. I mean, meanwhile, it's like, it's not a patient, it's my wife.
Yeah.
I think that my medical background in some ways made the early days a little bit easier, because in those early days, you're kind of watching for, is this normal? Is this medically normal? Are these girls okay? But then I started keeping spreadsheets of every minute that they were nursing, and every poop that they made, and every wet diaper that they made, because I began to kind of obsess around, like, are they eating enough? Are they drinking enough? Are they doing the things that they're supposed to do? And so there were pros and cons to that. A lot of people wonder, well, geez, you were a doctor, you should have recognized that postpartum depression can happen and could happen to you. And here's where my training wasn't helpful at all. I mean, I had a master's degree in psychology. I had done psychiatry rotations. I had cared for patients with mental illness, and I had no idea that this could happen. So it certainly wasn't helpful in recognizing what was going on inside of me. I just knew that it felt terrible all the time. I mean, the chest pains, the irregular heartbeat, the stabbing, gnawing, burning sense of anxiety in my chest at all hours of the day. I knew enough to know that that wasn't normal or healthy, but I sure as heck couldn't map that to any syndrome or disease, for lack of a better word.
In your research, like, how, I guess it depends on who actually puts their hand up and says they're dealing with this, but how common is postpartum for men? Like, I don't hear it a lot. I don't hear a lot of people talking about this. So do you have studies that talk about this?
There are a couple. There are a handful of studies that looked at assessing sort of the symptoms of depression or anxiety. So first of all, there's not a diagnostic category for this. So there's a big book of psychiatric diseases, and there is postpartum depression for mothers, and there's a whole thing on how you diagnose it and how you decide if somebody has it. That doesn't exist for men. In fact, it only has existed for women since the mid-90s. So we're not even that far along in recognizing that women can have postpartum depression. So there's nothing like that for men. So there are studies, though, that assess the symptoms of anxiety and the symptoms of depression. And when you lump all those studies together in something called a meta-analysis, you get a kind of a broader picture of the state of research in this area. So depending upon how you ask the question, you'll get numbers between sort of 8 and 25% of fathers will endorse symptoms that sound like depression, anxiety, and stress in the weeks or months following the delivery of their children. But you can't say that is postpartum depression, because, again, there's not really a classification or criterion for it.
Very interesting. Now, if you come into parenting in a mental state where you're not doing well beforehand, and then add this on top of that, now it's even potentially worse?
Well, that's true. So having depression at baseline is a risk factor for developing depression in the postnatal or postpartum period, having a spouse that has postpartum depression makes the non-birth partner, the father, more likely to get it. Being witness to birth trauma makes both parents more likely to get it. So there are some risk factors that we're aware of in those. I mean, I had never been diagnosed with depression beforehand, but certainly through the process of psychotherapy, we did identify a number of ways in which I probably had something like this my whole life.
And if I go back to my story, then being pushed out of the way in the corner of the room, told that my wife is a priority, and obviously all this stuff is important. I get all this, but I didn't know where to stand. I didn't know what to do. I always felt like I was in the way. Yet I got to be strong. I'm holding my wife's hand. I'm talking. She's listening to my voice. It's keeping her centered. All of that's happening, right? But at the same time, I'm like, there's nobody here for me. That's all I can hear in my head, right?
And what a great physical metaphor for what you were feeling inside. I didn't know where to stand. Yeah. I didn't know where I was supposed to put my body, but I need to be strong. How do you even know what being strong, like what are the behaviors that being strong looks like? How do you even, sorry, the mic. Yeah. How would one even know what that's supposed to look like? Yeah.
It's just me, my wife, and the medical team. So I don't have my dad with me. I don't have somebody older than me that's been through this in this environment. Just me,
Was your father still living at the time? And was he?
They were traveling.
Was he later a support? Okay.
Yeah, they were traveling to get to us at the time because it
cool.
Quickly,
okay.
Right? But there's no one else, And here I am, and people are looking asking me questions, and I'm like, I don't know. Yeah, do that. I don't know. I have no idea, right? Because I just felt so unprepared, even though I was trying to be prepared and ready. I didn't feel prepared. And so I want the dad listening to understand this, right, this is what happens.
Something that we experienced that was a little bit unique, and I write about this in the book too, that we delivered our twins in August of 2020, which means we were in the very early pre-vaccine part of the pandemic. And so, where you might normally be getting together with friends and other parents beforehand and having baby showers and father's showers and talking to your buddies who have done it before you, we didn't have any of that. And in fact, the rules for the hospital in terms of who, if anybody, could even be in the hospital, be in the room when your wife was giving birth, were changing week by week based on how many cases were being recorded in the community. And so if we had delivered a week before or 2 weeks before, there were periods of time where a doula or even the spouse would not have been allowed in the hospital, and she'd be delivering alone. And I mean, imagine that everything that she went through, from the sleep deprivation of the laboring period, and ultimately the cesarean section, and then all of the emergency and near-death experience that came as a result of that. And maybe, looking back, I wasn't very much help just given everything that was going on. But imagine doing that alone. And so we didn't have the pre-partum, so to speak, support group. And frankly, even afterwards, you might expect, the aunties come over and hold the baby, and grandma comes over and we had one group of friends, people actually that were not parents, who were great about coming by, dropping off huge bags of food on the sidewalk, because nobody would come in. But just that one set of friends. I mean, it was very isolating.
Right. And I guess the other part too that kind of hit me later on was my wife would be off celebrating, baby showers, going to get presents, meeting with friends and her friends, and me just being at home by myself, kind of wallowing in this, still not knowing my place, still not knowing, but then again, still feeling guilty. Like, Dave, why are you so self-focused right now? Like, you should be focused on her. You should be focused on your new baby. You should be focused.
But what does that even mean? Right. Like, I get it. I mean, I hear this theme that, like, I should have been doing this, I should have been doing that, but how, and I guess maybe asking that a different way, how did you then learn? How did you get better at this?
I don't know if I did a great job, to be honest. I think back on it, I don't. And the thing was,
do your kids still come for the holidays?
Yes.
You did a great job.
Yeah,
I think that's it. I think that's as good as it gets.
Thanks, everybody. We're done here. Yeah. But I didn't have resources like this. A book like yours, a podcast, a conversation with two dads, kind of sharing their own personal stories. Nobody I knew in that moment, I would even know how to. I didn't have the words to even ask somebody about what I was feeling, or if anybody else felt like this. And I felt really alone, I guess, in all of this.
Knowing what you know now, what words would you look for in a young father who was sort of reaching out for help? Or what words would you tell people to use to clue into people that this young father was struggling?
I think in one way I would say, don't put it on your partner to help you through this. They're dealing with their own stuff in the moment as well. They need your support. But also don't be so selfish with your time that you don't seek help. You don't have the conversation. You don't find that trusted person. And don't let it rattle you to the point where you shut yourself off from people. That's pretty dangerous, I find.
Absolutely.
Right. You need to surround yourself with people who are either a little bit ahead of you or right next to you, somebody in your life, right? For you, then, who was kind of in your corner? Who did you turn to?
Honestly, nobody. I remember reaching out to a friend of mine who had kids before me, and for the first time using the word anxious. I was telling him on the phone how anxious I was. And, people can offer sympathy, but people are not therapists. I remember talking to an uncle too that I'm close to, and they can offer sympathy and an ear. But until I found my therapist, it was very difficult to feel like I had support. Even my wife, who was doing everything she could to try to keep the train moving in the setting of everything that I was bringing to the table, something that she did. I mean, she insisted at some point, like, look, you have to get some help for this. You have to see somebody. And so the way that she supported that was she got her sister to help me find a therapist. So we're, looking online and Googling and interviewing people. And she made the time for me to meet with this person. And again, it was COVID. And so all of this stuff had moved to remote. And so that, I was going to say, it's in a way, it's never been easier to take the time to see a therapist because there's so many online resources now from things like BetterHelp and other, and they're not paying me to say that, but they're on a lot of podcast ads that you can access therapists remotely. And I now, 4 or 5 years into this, I still see my therapist, and we're still meeting remotely because if I had to drive to, an office, I would miss half my appointments. But Lindsay made the time amongst the very busy childcare, routine for me to be able to duck out and meet with this person. And it made all the difference. So really for me at the time, support would have felt like something different. It would have felt like giving in to these crazy, anxious, obsessive demands that I was having around how we structured our day and time and child rearing. But in retrospect, what was actually supportive was finding that I had this thing, insisting that I get help, and then making the time for me to get that help, to take that help.
So I could spend all day with you. I like this.
We could. I'm really,
again, I needed you so bad back then. I'm so glad we have you now. But for Even the Darkest Night, talk a little bit about the intent for you, the finish line. What is it for the reader that you're hoping this book captures?
Well, I think the intent at first was never to write a book. The intent was I was journaling as catharsis, and I had to get it out of me. But we very quickly, I mean, when Lindsay learned that I was writing about all this and read some of it, she was the one that really said, we should try to turn this into something. Nobody knows about this. And I think this could help a lot of people. And so over time, the goal has shifted from, because I'm doing a lot better. And so the goal has shifted from, I need this as a cathartic therapeutic activity, to the acknowledgement that if I had recognized this sooner and gotten help sooner, we could have avoided months of pain and suffering and agony, not just for me, but for the family. So my goal is that people will see themselves in these words and in these pages and say, I think my spouse might be going through this. He's indifferent and checked out and angry and irritable. And maybe it's none of those things. Maybe he has paternal depression. Maybe he's struggling. And if we can call it something, then maybe he can get some help.
When did the waves of this hit you as a new dad?
I don't remember a time when I wasn't anxious about them.
Really?
In those first nights when I was keeping the spreadsheet, of when did they feed? When did they get up? That's just a way to manage anxiety.
Right.
As an ICU physician, I can say, well, of course, this patient, you have to track these things. You won't know if they're getting enough in, getting enough out, and how they're doing. But really, it was a way to manage anxiety. But I think the things like the sleeplessness and the being stung awake in the night with panic, that came in the weeks or months after that.
Do you think this journey has changed your approach to how you deal with patients today?
Oh, if you had asked me that question 6 months or a year ago, I don't think I would have had as clear an answer. But what I'm realizing now, and I've had colleagues point this out to me too, that I'm kind of a different person than I was then. I'm more joyful. I'm more open to patients. I'll give you an example. My patients get my phone number now. And that's something I never would have done prior to having kids and trying to go through this kind of awakening. I would be afraid of people needing something from me, needing something that I didn't want to give or that I couldn't give. And I just simply don't feel that way anymore. I feel such a tremendous amount of openness to that I give them, my phone number. And so they could, they could call me anytime. They don't, or most don't. But just by virtue of the fact that I'm willing to do that, I know that I'm different. And I've had colleagues say that they see a different version of me too, one that's lighter, one that's happier. And because of that, I can be even more present in an emotional way for my patients, not just in a medical way.
What is one of the key things that you hope a reader is going to walk away with? We've kind of talked about some of the main ideas of the book, but if you could sum it down for us so that we're looking for it as a reader, what is it?
I think that a reader who is a parent, what I would like them to take away from is that you don't have to suffer alone. There is help for this thing.
Yeah.
And you can get better and you can find joy in parenting. For a policymaker as reader, for people in charge of healthcare, I think they need to take away from this that in addition to doing a better job of screening for maternal postpartum depression, we really need to be checking in with dads. And we really need to be devoting some time and energy in those first postpartum visits to really talking with the dad and really asking them like, hey, it's okay if you're feeling this way. You can tell me. This is not the throwaway, hey, how you doing? Oh, I'm fine. Like, I really need to know because it impacts you, it impacts your spouse, and it impacts the kids for you to be struggling. And a certain amount of this is normal, and a certain amount of this rises to the level of needing to be dealt with. And so for people that read this who are in a position to advocate for that, I think that's really what's needed.
What about a message from dads, from fathers to their partners, their wife? What do we need?
Most of the people that I talked to about writing this book in the early days were convinced that men won't read books, and that men really won't read books about mental health. And so from the very beginning, a lot of the kind of thinking around how to get this book into the right hands was through the spouse, was through the mother, the maternal parent. And so, my message to them is that if you're if your spouse is not themselves, you might find some value in reading this and trying to identify if this is the kind of thing that your husband, that your spouse is going through. Because, and I keep coming back to this and I don't mean to, but because if they are, it doesn't have to be that way. They can get better.
And then to the men who are typically fall under the banner of, I'm fine, I don't need to talk to anybody, I don't need doctors, I'm good, I don't need a checkup, I don't need any of this stuff, I'm good, right? From your advice to men, please help us.
Don't feel that way. Feel differently. I personally think that the more men that find themselves in therapy for whatever reason, the better off we are as a society. I'm pretty crunchy. I'm pretty liberal. I'm pretty granola, and I'm pretty touchy feely these days. And I really think that if more men talk to a therapist for 3 or 6 or 8 months, we would be in a better place societally in terms of empathy and compassion and fairness. And so if this is the hook, if identifying your postnatal paternal depression is the hook that gets you into therapy, great. I'm all for it.
Could be your gateway. Get right in there.
I hope so. Good. I hope so.
Okay, let's talk about the website as well. I'm going to have you come on Living the Next Chapter, my author podcast. I get more time with you and I'm thrilled.
Great.
But for dads, they want to get a copy of the book. They want to know more about you. We're going to follow you on Instagram as well because I keep doing those. By the way, I love them.
Yeah, thank you. I appreciate that. I got a couple more in the can, but
Good.
it's not my native kind of activity. Putting myself out there in that way, so it always takes a moment to gear up.
The
for
one
it.
by the coffee shop really caught my attention. 6 a.m. at the coffee shop, and this was your place to go, your sanctuary, the market. All of these things, I'm just like, I'm picturing myself in the moments as well, going to my place where I went, right? So thank you for that. But as far as connecting with you, grabbing a copy of the book and following you as an author now, where do we want to send our listeners?
It's ChristopherChoukalas.com. So it's just my full first name, full last name. And I hope that you'll be able to put a link somewhere because it's audio. I was thinking that there might be a video component because my name is hard to spell and pronounce. So Christopher is easy and Choukalas is Choukalas.com. And you'll see all of the links to other resources and, of course, pre-ordering and buying the book and some of the other places where you can find me talking about it.
It's beautiful. Chris, thank you so much for doing this. If you could write a prescription for a dad today around the theme of your book, what would the prescription say?
Be open.
Oh.
Be open.
Okay. There you go. We all have our prescription, everyone. Follow the doctor's advice, everyone. The doctor will see you now, and he did. Thank you so much, Christopher, for being on the show. Congratulations on the book, and I'm looking forward to having you on Living in the Next Chapter as well.
Thanks, Dave. This has been a real pleasure.
Excellent, everybody. All information, as always, in the show notes. Go grab a copy of Even the Darkest Night. It's available June 2nd, 2026, June, and we'd love for you to grab a copy and also share this with another dad. Please, because there's dads that need to hear this story, and grab a copy of this book as well. Chris, thanks so much for doing this. Appreciate it.
Thank you.
Hey, dads, thank you so much for being here. Thank you for being part of the podcast. Thank you for following the show. I'd encourage you to do just so. If you haven't done so already, look at your phone. There's like a little follow button or subscribe, or I don't know what it says on your screen, but there's like a little button at the top of the screen. If you click that button, that means every time a new episode of Dad Space shows up, it goes right to your phone. It's waiting for you whenever you're ready. So you don't have to try to remember, what's the name of that show? Space Dad? No, Dad Space. It'll show up right there for you if you follow the show. That'd be great. If you listen on Spotify, like I do, I'm a Spotify user. You can actually leave a comment in every episode, and I will respond as your faithful host to any comments you leave in the episodes. So please jump in. Love to read your comments, your thoughts about the episode. That'd be fun. And if ever you just want to hang out with another dad, you got a few moments on your time in your day, in your week, and you're like, I'd just like to grab a virtual coffee with Dave. You can always buy us a coffee at buymeacoffee.com, but you could also just join me for a virtual coffee and we could just chat about dad stuff. I'm always looking forward to meet the people who listen to this show. That brings me a lot of joy. So dadspace.ca, all the information in the show notes. And thank you for being here. And thank you for sharing this podcast with one other dad. I really appreciate you. Have a great day, and we'll talk to you on the next episode. Take care.